Hello and welcome to Health Digest, your go-to program where everything health-related and where we bring you insightful discussions and expert opinions to help you live a healthier life. My name is Ogom Ezedimbo. On the program today, we will be discussing common health conditions in children and tips for eye care and the importance of early detection and treatment. But before then, let's bring you our health news.
On Health News today, did you know that having hepatitis B infection without knowing or without adequate awareness on the dangers of the disease can lead to liver cancer or death in most cases? Well, that's what some health advocates and laboratory scientists said during a sensitization program held in Kabusa, a community in Abuja Municipal Area Council. In Nigeria, hepatitis B remains a significant public health challenge with a high prevalence rate. The organizers of this event, Project Pink Blue, insist that early detection, diagnosis and adequate awareness campaign about the infection can change the narrative.
Liver cancer has become a menace in our society. It's killing many people. The outcomes are terrible. So we are trying to see how we can prevent this disease, in underserved communities. So we are here today to do awareness, sensitization and vaccination free of charge for people in this community.
A medical scientist, Isaac Carrillo, tutored beneficiaries on how to avoid being infected with hepatitis B.
This virus goes straight to affect the liver and causes a very serious liver problem, which can result in liver cancer, for instance. And of course, once the liver is down, the body begins to shut down, so eventually leads to death.
For my own result is negative, so I'm happy. And we are so happy in the community because it's a very good initiative so that people should be aware of their health status, more especially hepatitis B.
One of the beneficiaries of the free screening, Dangiwa Meriga, tested negative of hepatitis B and has this to say.
With the lectures that went on, knowing what brings about the hepatitis B, I'll be more careful now and more extra careful, knowing flu that I don't have. So I'll be more careful not to contact the hepatitis B.
Hepatitis B is a viral infection that affects the liver, and it is caused by the hepatitis B virus and can cause liver cancer and even death if left untreated. Experts are calling for a paradigm shift in malaria treatment as they push for the exclusive use of artemisinin combination-based therapies, ACTs, in combating the disease. ACTs are the globally accepted standard for treating uncomplicated malaria cases, and experts emphasize that monotherapies, which is legally prohibited and ineffective, should no longer be in use.
Country, there are different parasites. When you call the Plasmodium falciparum is what we have, it's higher in the country. So that is what is more common, and ACTs are able to completely eliminate the parasites from the blood system. ACTs have a longer shelf life compared to the monotherapies. So you have the mefentrine about 4 to 10 hours, amodiaquine 9 to 13 hours, piperacquine 8 to 12 days, and pyrinoridine 1 to 2 days.
It's very, very important we test just so that we're able to accurately or treat the disease, confirm it, and then treat it appropriately. By doing that, you will save the person the economic implications or the economic burden of the disease.
The experts noted that fight against malaria in Nigeria has been complicated by environmental factors, making malaria transmission a constant risk throughout Nigeria.
The messages of malaria diagnosis and as well as treatment. We believe in you, that with you working with us, collaborating with us in this regard, we believe that malaria can be eliminated in this nation. Just like I've said, Singapore eliminated malaria not with the use of medicine, but through environmental sanitation, through SSM. which was done with the collaboration of media.
Despite progress in reducing malaria prevalence, particularly among children under 5, the numbers remain alarming. No doubt, Nigeria has made strides in the fight against malaria, but experts stress that more efforts is needed to meet the 2030 targets of eliminating malaria. Proper case management, treatment adherence, and public health campaigns are essential to achieving this goal. The Nigerian government says it is intensifying efforts to ensure that no pregnant woman loses her life due to emergency complications. Chairman of the National Emergency Medical Treatment Committee, Ismail Ajibrin, who made this declaration in Abuja at the committee's retreat, said the government is prioritizing maternal health as emergency medical services are operational in 16 states. Ismaila stressed that a well-functioning emergency medical service is crucial to reducing preventable deaths and strengthening Nigeria's healthcare system.
First, there is lack of awareness in our communities about the presence of this service, even about the existence of an emergency toll-free number that anybody can call, 112, and get a response quickly. Secondly, we understand our community doesn't quite understand that it is much easier and faster to call this help than to drag somebody into a taxi or kidnap into to a hospital.
It is important for this to be deepened and penetrated to our people. A lot of our people, even when they have emergencies, do not believe that they should call an ambulance service or a means of transportation, a formal means of transportation. So because of that awareness, we generally have some challenges in that respect.
The National Emergency Medical Treatment Committee Secretary, Saidu Dumboa, also said the federal government, through the Basic Healthcare Provision Fund, is providing critical support for emergency services in Nigeria.
What we want is not the issue of money at the moment now, it's the issue of demand creation. People to understand such things happen, and the state government are committed to actually ensure they roll out in their own states, either at a pilot or a full scale. Then the issue of money will come. But at the moment, we don't have issue of money to pay for that at the moment. Maybe later, when more lives are saved and more medical responses, emergency responses are actually coming up, and we're actually saving more lives, then certainly we'll actually come back to say we need more money from the government.
To access these services, Nigerians can dial the toll-free number 1122 in emergency situations. The National Emergency Medical Treatment Committee is charged with the responsibility of responding to health emergencies. That's it on Health News.
The program is Health Digest. October is the month dedicated to raising awareness about our eyes, and this year's theme is Love Your Eyes Kids. Eye health is crucial, especially for children, as early care can prevent long-term problems. So in today's episode, we'll be diving into the world of pediatric healthcare, learning how to take care of the children's eyes and the importance of routine eye checkup. So I have in the studio, to my right, I have Dr. Priscilla Nedu. She is an optometrist and also the co-chair for World Sight Day 2024.
Thank you very much for having us.
On my far right, I have Dr. Aniko Chidima, also an optometrist and member Education Committee.
Thank you so much. We're glad to be here.
Thank you very much. And so I'll start with you, Dr. Nedu.
Okay.
We are focusing on children's health.
Yes, please.
Why is it so? Is it that we are having an alarming rate of eye issues among children?
All the years, focus has actually not been on kids. And then, of course, kids are the future of tomorrow. You know, we are the leaders. In fact, I remember when we were much younger, we were always saying that kids are the leaders of tomorrow. And, you know, here we are now, we are adults and we have our own kids, and then of course children are being born every day, and then the rate of refractive errors, the rate of blindness in kids have just been increasing. Just take a look at the School of the Blind. You realize that the School of the Blind, at least more than half are actually kids and teenagers, and you would wonder what is actually happening. Is it that the awareness is not being properly created, you know? And adults have actually been, you know, well catered for to some extent, for which it's still an ongoing process. And then over the years, the theme has actually been, for this few years, the theme for for the World Sight Day commemorations have been Love Your Eyes. Okay, so last year it was actually Love Your Eyes at Work, and we had good progress with that, and then realized that, oh, kids are under good focus, and the kids seem to be a bit abandoned in this aspect. In fact, the fact that many parents even still feel to today that the children, they're still children, they don't need an eye test, it has actually become very worrisome, which is one of the reasons why the World Health Organization, the IAPB, in collaboration with WHO, national, international, have decided that this year's theme is going to be Love Your Eyes Kids. Love Your Eyes Kids, to prioritize the eye health of kids, and to also make kids also to know they should love their eyes, because there are different and 1,000 causes that could lead to blindness and loss of vision or visual impairment in children.
Now, let's talking about causes, Dr. Anika, what could be causes of eye issues among children?
Okay, so there are several, and as funny as it may sound, refractive error is one of the leading causes of preventable blindness or visual impairment in children. Now, there's this thing, I don't know if we have made enough noise about it, or if we've created enough awareness. The rate at which myopia progresses is alarming at present, because a lot of children are exposed to a lot of things that some of us or some of the older generation were not exposed to. For instance, exposure to devices. You know, you notice that nowadays children spend less time outside, you know, for several reasons, security reasons. You know, we want them to be more academically oriented, because we want them, you know, to grow up to be, you know, better than us and all that. So the focus has changed in the way children are brought up now, and that has a remarkable effect on their eyes. You notice that the increase in myopia has doubled. It's becoming alarming, and you may think, oh, myopia is just a refractive error. It's not just a refractive error, it has consequences. You know that uncontrolled myopia can actually lead to several other things, including glaucoma, cataract, retinal detachment, and all these things can cause visual impairment, visual loss, and all that. And for a child to become visually impaired or blind, you know, the impact it will have on the society is actually larger, because one, the parents will suffer it, the child will suffer it, people around the child. So even the economic impact is grave, and the child's prospect in life is further reduced. So we really want to bring to the notice of everyone that having the eye health of our children is very important, and it's something we should look into and embrace.
Now, she talked about refractive error.
Yes.
She talked about myopia. What are these conditions?
Okay, when it comes to refractive errors, it's actually a refractive error is like a deviation from the perfect vision,
okay,
from the norm.
Okay.
We have what we call the emmetropic eye, and we have what we call the ametropic eye. The emmetropic eye is a standard vision, where a child is the WHO standard 20/20 vision. That is actually emmetropic eye. I believe we all understand it as that. In the clinic, we see it as 6/6 vision, okay, and then where you're able to also see your reading print at least M5, we have it as M4, okay, but the WHO standard is 20/20 vision, okay. So now the emmetropic eye, everyone is to some extent is born with some level of refractive error. Now we have what we call emmetropization. The emmetropization takes place to when a child is about 6 years old, and then gradually stabilizes to like 9-10 years, and then after that the child tends to now become tends towards myopia. Okay, that myopia is actually another refractive error that has to do with the difficulties in being able to see images at far clearly, where rays of light enters the eye and form a point focus before the retina. So it comes basically with the different forms where the eyeball can actually be longer, we call that axial myopia, or the parts where the cornea can actually be steep, or from the structure, that's actually more of a structural myopia. So you can also have astigmatism, you can now have hyperopia, where the metropolization does not get to be completed, or you now have the myopia, where the person becomes short-sighted, where the eyeball is now longer or the cornea is too steep. But the hyperopic aspect is where you now get to have difficulties in seeing your near images. It still happens to basically everyone, okay, not basically only children. Or myopia happens to even adults, because you still see the adults, some becoming of course short-sighted as they even grow, okay, because the eyeball grew to that level. Then astigmatism has to do with eyeball surface being irregular. So it could also, astigmatism works either a short-sighted eye or a long-sighted eye. So if you don't get to see your optometrist, you don't get to have your eyes checked regularly, you might not get to know that, okay, this is the error that is happening. Okay, basically someone might say, oh, I'm only experiencing blurred vision. I know if I go to the clinic, they might even give me only glasses. But funny enough, if you don't, and there are other cases that could also cause blurred vision. So might just be talking about myopia. What about the other causes that come with blurred vision that are undiagnosed because you just assume that I need only glasses? Basically, that's where one of the advocacies that we're coming for, to sensitize the public, because we're looking at cases where there could even be congenital glaucoma. Okay, some babies can even be born with certain disease, certain sight-threatening disease. That is not just myopia, okay? Even though myopia and refractive errors are the leading cause of vision impairment and blindness, these other underlying causes for kids are also a point of focus as well. We have the congenital ophthalmos. Okay, the ophthalmos is actually glaucoma from birth. Then we have the ophthalmia neonatorum. Those are actually infections that could also lead to blindness.
She said children are sometimes born with these errors. You run a clinic. How often do children come for checkup? Do parents just bring their children and say, I want to come and check my child's eyes?
Yes, some parents do.
When there are no issues, like physical issues, I just want to check if my child's eyes are...
No, they don't do that. Okay. So most times parents come to the clinic when the child has complained, when they see something wrong, or when a teacher has pointed out something. So most times teachers are very instrumental because they spend a lot of time with the child. And most times when a child is in school, the eye is one of the most used organs. Eye is used, So a teacher notices when a child can see the board well and when he can't. So in this case, I've noticed that most times, yes, parents do. But we also do outreaches. And when we go for outreaches, we notice that maybe these parents that bring their children, they are well-to-do, so finance is not a problem. But the underserved, a lot of them do not have that reach. A lot of them, yes, do not have that advantage. So we've gone for outreaches, I've gone for school screenings, and I've seen a lot of children with severe cases of amblyopia. Now, amblyopia is a condition that cannot be cured with lenses. It's reduction in vision that cannot be corrected with lenses, contact lenses, drugs, or even surgery. We have to do specific amblyopic treatments for that. That's another case. Now, this shows that a lot of children do not receive the care they need at the point they need it. We've seen people with severe cases of vernal conjunctivitis. That's like a severe case of allergy. You see a child rubbing his eyes, you think it's normal, but for some people it can actually lead to blindness, and we've seen it unattended too. Most time these cases, eye drops can just take care of it. Something as simple as eye drops, but they don't have that coverage. They don't have the, they can't get that, or their parents are unable to afford them that. So apart from the well-to-do parents bringing their children to the clinics, we still have a lot of them who, do not have that privilege.
Wow. So that which means somehow nutrition has a way of playing itself when it comes to high health for children?
A whole lot, which is one of the reasons why we also advise parents to include fruits in their children's diet.
How many people can afford fruits?
I remember plucking mangoes from a mango tree myself, climbed up a mango tree to pluck mango. So that's one of the reasons why we're also advocating for green areas. Parents can also plant them. You can plant. We have the almond fruits. They are freely given. You can plant your orange trees because vitamin A, vitamin C, antioxidants are richly found in these fruits. Okay, we have most lutein, zeaxanthin, okay, are found in basically, you see them in beetroots, you see them in grapes, you see them in most red fruits, okay? And then if parents can't, I don't know, well, if you can't afford, try to plant. For me, that's my own. But by all means, let the kids take at least a fruit, possibly a day. And then also encourage fish eating because of the omega-3 rich constituent you get to see that helps in lubricating the eyes and keeping the eye health also intact. Even for elderly ones who tear a lot, you still advise them do omega-3 rich meals. Apart from your antioxidant rich vegetables, fruits, the fruits are rich in them. Okay, we advise you take them regularly.
Now, what are some eye-friendly habits parents can encourage at home? Because you've talked about staying focused to the screens. Yes. Apart from telling your child, some children can be very stubborn. Apart from telling them to leave the television or leave your phone, what other habits can they encourage their children to do to have a good health?
So spending time outdoors is very good. There's something about the sun, vitamin D. Very important. Another thing is we need to discourage our children from rubbing their eyes. Okay, so try to discourage them from rubbing their eyes. Then playing with sharp objects. All right, because the accidents that come, injuries that come from such accidents are most times are very severe. So we need to advise them not to play with sharp objects and take away such sharp objects from around their vicinity or play areas. It will also be good to advise children, it's good to blink. Do because blinking is a way of moisturizing the eye. So you're taking tears all through the eye. So blink. Most times people are concentrated watching TVs, watching their tablets. The blink rate decreases. There's a reduction in the blink rate. So encourage them to do that. Drink a lot of water. Just be healthy. That's what. And then, if you notice anything, please come and see your optometrist or any other certified eye care professional.
So that area of, let me just quickly branch the pharmacy and then buy
something. No, we've seen several complications and it's not advisable. So make sure you see a certified eye care professional.
So this is all about children. What plans are you making? Because right now they're in schools. Yes. Do you tend to go to schools to go see these children to have a test run for them? What are your plans for this website Day 2024?
Okay, like we are working towards having a vision corridor for schools, especially the public schools, which is one of the reasons why we're here today, to let the parents understand the importance of these eye checks. It is not detrimental to their children's health. Try to help us pick out where these issues are coming from and nip them in the bud on time, because everyone knows that prevention is always better than cure, and early detection will always help save those. Okay, so that's what Nigerian Optometric Association is advocating for. For this World Sight Day program. We are holding vision corridors in schools, and we would also do 1 or 2 screenings in other places. At the same time, we also intend to do a walk from Gariki Area 10, from Gariki area, from Area 1 to Area 10, to sensitize the public as well, to create the awareness for parents to walk into any clinic, any eye clinic, you know, especially our optometry clinics, and of course licensed eye care practitioners, to run their children's eye test. So our doors will be open at least from the 7th of October to the 12th of October, although the 10th of October is the basic day that the world is commemorating this event. But our clinics will all be open from the 7th to the 12th of October. Parents can freely please take their kids to eye clinics, you know, and let them know that they have come to run an eye screening for their kids. At the same time, I also want to salute many schools that have actually included it as a point of their project and their process for school registration, that before school resumes, most times you see many schools will tell you must go and fill up your health records. Okay, so that also includes their visual acuity check, their color vision test, all the tools that requires any form of picking out of any of these underlying refractive errors. Most schools have actually been incorporating it. So I also want to advocate for many other people to adopt this system, while we also do our own part to, you know, make sure we reduce and readjust any form of preventable blindness and visual impairment.
All right, thank you, Dr. Anejo. Maybe I'll give Dr. Aniko Chidima for your last word, please.
Okay. So it's important for parents to know that most times children are unable to say what they're feeling. Most times a child cannot come and tell you how he's feeling because he or she does not understand it well. A child may be able to see, excuse me, blurry vision and think that's how every other person sees it. So it is important. Don't wait for your child to say my eye is paining me, or my eye is itchy, or is this, is that. Bring your child for an eye test. Take your child to see your optometrist or any other certified eye care professional.
Thank you so much. I have been speaking with Dr. Priscilla Nedu, an optometrist, and also Dr. Aniko Chidima, also an optometrist. Thank you so much for your contributions for today. Thank you so much. And so it's important to emphasize the action we can take, regular eye examination, protective eyewear, and healthy habits all contribute to strong and healthy eyes. As part of this year's theme, Love Your Eyes Kids, Health Digest crew is urging parents and teachers to educate children on the importance of their vision and how to care for it. Remember, your child's vision is a precious gift that needs care and attention. Until next time, stay safe. I am Ogom Izedinbo.